Hey there, I'm Katie Jones, and I am a certified Christian financial counselor, which is just a fancy way of saying that I am very passionate about helping Christians learn excellent money management skills that are rooted in the gospel. One of my favorite things to share with you is how to save money on health-related expenses. And my favorite way to actually reduce the cost of health expenses in general is by switching to a non-traditional health insurance alternative. Christian Healthcare Ministries is what my husband and I have been using for the last 4-ish years now, instead of, or as a replacement of, health insurance, traditional health insurance. Christian Healthcare Ministries is a health cost sharing program, and they have been honestly so awesome to us. We have had a lot of experience with them in the last 4 years. Soon after becoming Christian Healthcare Ministries members, I had a knee injury that resulted in needing surgery. And then this year alone, in 2024, both my husband and I have experienced a few different things, including an emergency run for my husband in the ambulance, resulting in an ankle surgery. And then not only that, but we actually just welcomed and celebrated the birth of our son a few months ago. And so now in this video, I want to share with you a little bit about our experience with the Christian Healthcare Ministries maternity program. So I'll be sharing my review of it, as well as answering some of the common questions about the maternity program. But as usual, if you have any questions about the maternity program itself or anything related to Christian Healthcare Ministries, please drop your questions in the comments below. Many of my videos that I create, especially about Christian Healthcare Ministries here, have been the result of your questions. So feel free to go check out some of the other videos that I have about Christian Healthcare Ministries. I have a full review if you're not familiar with CHM. I kind of explain how it all works. I also have some videos on how we manage bills and submit bills and things like that. So I'll have links to all those things in the description below. And if you're not already a CHM member and you're considering becoming a member, maybe based on this review of their maternity program, I would absolutely love if you would consider using our family's referral link to sign up for Christian Healthcare Ministries. When you use that link to sign up, we do receive a small kickback, and my family and I greatly appreciate the support of not only us, but what I do here on my channel. So thank you so much in advance. So overall, we have had a really good experience with the CHM maternity program, up until we actually experienced a few complications with my labor and birth. And before you panic and turn off the video, I want to explain how you can actually do things differently in order to not experience these hiccups. So the thing that I actually messed up on when it comes to actually our program or our level that we're at with Christian Healthcare Ministries was, yes, we have always been on the gold member program with CHM. However, what we did not have added on to the gold membership was their Brothers Keeper program, which has actually been renamed recently to CHM Plus. And so what this program does is, on the gold level, your share limit, so you have a limit to how many expenses, or how much you can actually have shared within the ministry. And so it's somewhere around 125,000. This is plenty enough for most medical events, including my knee surgery that I had, my husband's his ambulance run and ER and surgery for his ankle. It all covered that fine. And it would have been totally fine for our pregnancy, way more than enough for the whole pregnancy and labor and birth of our son. Except for the fact that I and my son got very, very ill during my labor. And so we actually ended up needing to be hospitalized for about a month each. And so that resulted in having around $3 million worth of medical expenses, and it was quite a lot. And so the mistake that we had made was not having the CHM Plus program as a part of our membership. And so what I would highly recommend you do, if you still have the chance to change it, is to add that program onto your membership, because that allows your sharing limit to be unlimited. So if you have complications, whether it's from any other medical related event or within your pregnancy and labor, then CHM will be able to share all of those expenses. Now, the reason why I'm still here and still cheery and still highly recommend the CHM program was that we actually found out through this process that we were able to qualify for Medicaid. Then once we got Medicaid, it was able to cover every other expense that CHM had not already paid for with my pregnancy and labor and everything like that. Overall, I would highly recommend the Christian Healthcare Ministries Maternity program. I highly recommend that if you do choose to use the maternity program, that you add the Brother's Keeper or the CHM Plus program to your membership, because you just never know. Everything was going very, very smoothly within our pregnancy. There were no complications along the way. There was just some stuff that happened at birth that ultimately led to my baby and I being hospitalized for quite a while and incurring lots and lots of expenses for that wonderful hospital stay. So definitely would recommend it, but also with the CHM Plus program. Okay, so that's it for my kind of review in a nutshell, but I want to answer a few questions that I have received about the maternity program in general, as well as questions that I had going into our pregnancy. I just wanted to get these questions answered. So you might have these similar questions. Feel free to jump down into the different chapters of this video, because there will be a few different questions I answer. You may already know the answers to some of them and may just only want to get your questions answered. So if you go into the description, you can see the time frames of each question that I ask or answer, and you can always jump to those instead of watching the whole thing, just to save you some time. So the first question that I want to answer for you is, how do I get my questions answered when I have them? And there's actually a few ways that you can get your questions answered about the CHM maternity program. They make it really easy, I think, to get your questions answered. CHM not only has a phone line that you can call, and then you go through the prompts and it takes you to their actual maternity support system. So you can go through and get questions answered that way. They also have an email address, which is just maternity@chministries.org. So you can always email in your questions there. I actually use that and would get answers pretty quickly, I think within a day or so. They also have a CHM maternity Facebook group, and I highly recommend that if you are already pregnant within the CHM Ministries program, or if you're planning on getting pregnant, joining that Facebook group. I actually had some of my questions answered by going through that group. I also had questions answered that I didn't even know I wanted to know the answers to, which was super helpful. There's just a lot of support in there as well. And then they do have actual CHM staff who go through and answer questions when they can. So I highly recommend that. The other way you can get questions answered is always by dropping them here in the comments, and I am happy to look into whatever I can for you as well. So definitely do that if you have other questions. Recording videos with a newborn is definitely very challenging, and I'm still trying to figure out this process while having a new baby around. And so hence I am wearing something different and have no makeup on, and the lighting is lots different than it was the other day because it's late at night and it's several days later from when I first started recording this video. However, it actually poses a benefit to all of us, because in the few days from when I started recording this video until today, I actually received an email from Christian Healthcare Ministries about the 2025 updates to the program. And specifically, there are changes to the maternity program. So this is really interesting, because I was going to start sharing some of the qualifications and the prices and everything like that for the maternity program, which have now changed. So this is a great thing for all of us because we're all learning together. The next question I wanted to share with you or answer for you are, what are the qualifications for the maternity program, to be a part of the maternity program? There are 2 qualifications. The first one has not changed. It is that the mother must be married at the time of conception, and they have to be married to her husband, or the baby has to be from her husband. The second qualification used to be that you had to be a part of the Gold program, the CHM Gold program, for at least 300 days prior to your expected due date. However, you can now be a part of either the Gold program, the Silver, or the Bronze program and still have your maternity-related expenses shared within the ministry. So this is a really cool update. The personal responsibility is different for each of these programs, but you can now be a part of any of these 3 programs and still have your maternity expenses shared, which was not the case before. So that is a really exciting update for all of us. It should also be noted that it isn't labeled as one of the qualifications. However, if your pregnancy was the result of IVF or embryo implants or transfers, or I think IUI also is included in that, then that makes the maternity event ineligible, unfortunately. So if you are trying to conceive from one of these ways, the CHM maternity program may not be a great fit for you. So my next question then would be, how much does the maternity program cost at CHM? And again, this has changed because before it used to be $1,000 for your personal responsibility. We're actually technically $1,500, and then you could get it reduced. However, now that has increased for 2025. So if you already are using the maternity program at CHM in 2024, then this doesn't apply to you yet. However, if you are considering the CHM maternity program in the future, this will be the new price structure for you. And again, this is considered similar to a deductible. It is separate from your annual personal responsibility. So if you've had other medical events throughout the year and you paid your personal responsibility for those, if you get pregnant, you would also have another personal responsibility for the maternity event specifically. The just general personal responsibility for medical events unrelated to the maternity stuff, that is annually for each individual. So like a husband would have, their personal responsibility, a wife would have their personal responsibility. Gosh, I can't say that fast. You can still get that reduced by calling the Christian Healthcare Ministries support line to let them know that you are pregnant within the first 16 weeks of your pregnancy. And just to clarify, I did read that it is still a $500 reduction of your personal responsibility, and it sounds like that should be applied to each of the programs, Gold, Silver, and Bronze. So making that phone call to Christian Healthcare Ministries to let them know that you're pregnant is super easy. Again, if you do it within the first 16 weeks, you do get a $500 reduction on your personal responsibility for the maternity event. And these are the questions that they basically asked me on the phone. They asked me where I plan to deliver, who my doctor would be, and their address. It's super easy to change who your provider is. You have to write in a note to CHM and submit that just to let them know why you are making that change. However, that shouldn't be an issue. The only bump in the road that you may experience is if you've paid your global fee already and you have not received those services, which actually technically has happened to me. I paid my global fee to the birth center that I was planning on giving birth at, and then the complications arose. We got transferred to the hospital and then technically gave birth there. So the hospital has now charged me for the actual delivery fees, which my birth center had already charged me for, but we didn't deliver there. So we're still waiting on getting the refund. Once we receive the refund and everything, we have to submit that to Christian Healthcare Ministries in order to get the actual hospital bills paid for the delivery. So we're still waiting on that, but it seems like once I have those, I can just kind of take care of that pretty easily. So hopefully that isn't a problem. The other question they asked me was, did I have any current complications that I was aware of? At the time, I was only, maybe like 6 weeks pregnant or so. So I had no idea if I had any complications because I hadn't even seen my doctor yet for my pregnancy. So I let them know no. They did also ask what number pregnancy this was for us. I don't know why they needed to know, but they did ask for that. They did say this included if I had any miscarriages or anything along those lines. And then again, I mentioned that babies conceived with IVF or IUI those pregnancies are not eligible for sharing within CHM. So they did ask me if my pregnancy was a result of that. The phone call was really great. I had a very good experience with the woman on the phone. I didn't catch her name. However, she did let me know that there is a maternity nurse navigator whose name is Caitlin. And if I had any questions about my pregnancy or just concerns that I had, she was available to answer those questions. At the end of the phone call, the woman had let me know that I would be receiving an email confirming that I had the $500 deduction on my personal responsibility, which I did receive, and that was wonderful. And then she just reminded me to make sure to get the global fee from whoever my provider was going to be. So I keep mentioning this global fee. What exactly is a global fee? Because that was something that I was not familiar with before jumping into this whole maternity event and everything. It's a complete one-time bill structure that covers all professional services related to maternity care. So this includes prenatal care, the delivery, and postpartum care, but typically does not include the first visit to your provider to confirm your pregnancy. So for example, I called my birth center to make an appointment with them, told them that I had a positive pregnancy test, when that positive pregnancy test was, and then I came in and I had to pay out of pocket for that initial appointment. After that, they did put together a global fee, which included all of my visits that I would have up until my actual delivery. And then there was also the fee for my delivery. And then there was a few appointments that were included in that for the postnatal care. My birth center also included some birth classes and breastfeeding classes and things like that. So those things were not covered by Christian Healthcare Ministries, but basically it was a complete itemized bill with everything that would be included within my care within the birth center. I submitted that to CHM. It was somewhere around $10,000 after the self-pay discounts were applied to it. And so CHM then sent me that check in the mail for the entire global fee, and then I went and paid the birth center the entire amount once I received that. Now you receive the check, the disbursement check for the global fee around 30 weeks or so. Some people have said they've received it earlier, and some people have said that they have received it later. It really kind of depends on when you submit the bill, as well as how quickly CHM is going through them at the time. So I would highly recommend the moment that you get that global fee, send it in. And same thing, like check with your provider immediately and keep pressing them until you get that global fee so you can send it into CHM and then pay for all of that up front. And it should also be noted as a reminder always that as a CHM member, if you incur any late fees with any provider, not just in the maternity program, but for any provider, you are responsible for those late fees because you sign an agreement with CHM saying that like you will continue to stay up to date with all of your payments, and that CHM is not responsible for those late fees. So if with your provider they are requiring you to start paying on that before you receive the disbursement from CHM, make sure to set up that payment plan and start making payments so that you don't incur any kind of late fees or fines or anything like that. So what expenses are actually shareable within the CHM maternity program? I'm going to post a whole list here and make a few notes on some things, but I'll let you pause the video and read through them instead of me just sitting here and reading off of a list. CHM will share all the postnatal expenses up until 90 days after delivery. And so if you do have any continued visits that are maternity related past those 90 days, they will have to be considered a separate event within like the bill submitting process. So that's important to note, especially if you do experience any kind of complications. So just be aware of that. CHM will let you know. So don't worry too much about it, but it is just something to note. And now I'll post the image of all of the ineligible maternity related expenses. Now, it's really important to note that there were certain genetic testing things that are included within CHM, but they have to be considered required by your obstetrician or your midwife. So they will likely have to like write in some kind of letter if they're like, you need to get this specific genetic test. However, if it's not required by your obstetrician and if it's just kind of considered like normal, like they just do it, those specific tests are not shareable. And I did learn that because I kind of thought that certain non-invasive tests were included within the sharing eligibilities. However, I did receive like a letter or a note, or I think it was an email that said like this specific expense was not actually shareable. CHM does not share the costs for breast pumps, which is slightly frustrating and annoying just because under the Affordable Cares Act, you would be entitled to receive a free breast pump through insurance. However, since Christian Healthcare Ministries is not technically insurance, they don't share the cost for a breast pump. This was definitely something that was like slightly frustrating to me. However, I did find out that through WIC, if you receive WIC benefits, you can apply for a breast pump as well. You can probably also contact your local WIC office just to see if they have any kind of special benefits for you. Also, vaccines for your baby are not a shareable expense within CHM. However, I did actually learn a really interesting little tip from our primary care for our baby, who recommended to check with our local Department of Health to get vaccines done. He actually recommended doing it that way and not through him, because if we went through him and paid out of pocket there, then we would have had to pay like full price. And if you go to your Department of Health, they offer them at discounted rates as well as potentially for free. So in our case, we actually got vaccines for our baby totally for free, which was super cool. So I definitely recommend checking that out if you are planning on getting your baby vaccinated. Now, home births are just like slightly a little different. So what does CHM cover for home births? Well, if you go back and look at the list of eligible expenses, home births are listed there. There were a few mamas in the CHM Maternity Facebook group who said CHM was able to pay for their birth kit as long as clearly from a birthing site. And it was the birth kit requested by their midwife. It can't be like something off of Amazon. It has to be kind of more like a medical devices website. So that way it's like more legit, I guess. I will put a link to one of the websites that one of the mamas in the Facebook group recommended. It's called In His Hands Birth Supply. So I copied the link that she shared within the group, and I will put it in the description here for you to check out. Some other areas of kind of confusion, or maybe just that need some clarification, are twins, if you are giving birth to twins. So there have been a number of mamas in the Facebook group that have mentioned having a good experience giving birth to twins and using the CHM maternity program. And then there was a staff member who actually had commented in the Facebook group somewhere that said that twins are eligible for sharing, and that CHM will probably just ask you to upload a letter of explanation letting them know that you are submitting bills for basically two babies. So that way they're not like, why are there duplicates of certain things, or why are they being charged twice, or whatever. So you will probably want to just like write in and say like, we're giving birth to twins. CHM does cover the cost of lactation consultations. They are only eligible for sharing after delivery. It wasn't super clear if there is a limit to how many consultations you can have. From my understanding, as long as the consultation is considered necessary, then there probably is no limit. CHM will cover the costs of any kind of complications from the birth and labor. And if you are on just the gold, silver, or bronze program and don't have the CHM Plus program, there is a limit to how much they will actually share. I definitely highly recommend having the CHM Plus program, whether you expect to have complications or not. Okay, the last question is, at what point does baby need to be on their own CHM membership? And the answer is that once they have hit 90 days after their birth, so once they're 90 days old or roughly 3 months, then they need to be on their own membership plan. Something cool about Christian Healthcare Ministries is that if you have multiple children, they are actually considered one unit. So if this is your second birth, your second pregnancy, your second baby, your membership will look like, 3 units, even though you have 4 people. So it'll be husband and wife and then children as one, which is super cool that you don't have to pay for all these multiple children, especially if you have lots of them. I hope this covers some of your just kind of like big questions. Obviously, if you have any more that weren't answered here in this video, please drop them in the comments below or jump over into the Facebook group. I am actually pretty active in there as well, helping other mamas. Otherwise, you can always call the CHM helpline. I am not employed or sponsored by CHM. I am just a member who definitely is very passionate about Christian Healthcare Ministries and just want to help you if you are considering becoming a member. Again, if you aren't a member and you are considering it, I would love if you used our family's referral link to sign up. We do get a small kickback from them, from Christian Healthcare Ministries, and we greatly appreciate the support. All right, that is everything, and I'm glad that I was able to record this video. So thanks so much for sticking around. See you next time.